Welcome back to another Kentucky Magazine, where we're going to talk about a pain in your back with Dr. Kendall Gerhardt, who joins us. And you've been here before trying to help us out with that constant chronic back pain that so many people have. And if there's anything that people don't want to hear, it's surgery when it comes to the back. And as I read your little liner note, it said the latest cutting edge, but it wasn't about knives. It was about a spinal decompression technique that you have.
What spinal decompression is, Nancy, is it's a machine that can help to separate the vertebrae and take that compression off of the disc in your back. Because what we found, and we've treated many people that have had surgery and have what's called failed back syndrome, simply cutting away part of the bone or snipping off the bulged disc part doesn't fix anything, because it's a compression issue to begin with. And if all you're doing is just snipping stuff off, you're not making room, or you're not decompressing or getting rid of the pressure on those discs.
So each of the vertebrae that are in our backs have a disc that is within and then at the top and bottom?
Right.
And
what happens is the way that the spine is designed is it bone, disc, and bone.
Okay.
And the disc is the shock absorber between the vertebrae, so you don't have bone rubbing on bone. And what happens as people get older, you start to lose the integrity of this. It's called the annulus fibrosus, this outer ring, the protective covering there. And as this material starts to bulge outward, whether it's going to the side or going straight back up against the spinal cord, you start to develop pain. And what people notice is that if it's just still contained within the disc space, you get back pain. But as soon as that disc material pushes out beyond the disc space, you start to develop nerve pain. Sciatica, for example, a lot of people suffer with that.
Yes. This isn't injury caused. This is something that just aging and just the wear and tear of our bodies causes?
Yes and yes.
Yes and yes.
Yes, a lot of times it is injury induced, but usually when it's a frank herniation, that somebody that did something, they lifted, pop, and they felt it. Many times that is the ones that do need surgery, because you can get what's called a sequestered disc, and a piece of this breaks off. And that does need to be removed. But most of the time, people injure their back, it never heals properly. Then just over the years, it continues to get a little worse and a little worse and a little more bulging, a little more bulging. And then finally, it gets to a point where there's some nerve root compression.
How can you determine who might be a candidate for spinal decompression? When we come to your office, how do you make that determination?
Multiple things. Number one is we take a very good thorough history. So we got to find out any injuries, any traumas that they've had in the past. We do find out a little bit about family history, because many people do have moms, dads, grandmas, grandpas that had back
medical history.
Then we do some specific neurologic testing. For example, we're testing nerves, reflexes, and we're also testing muscle strength. And then one of the major components that we use is MRI. Because we want to review what the MRI shows, because everybody knows X-ray will show bones, but the MRI shows the soft tissue in here. So that will specifically tell me where the bulge is, if it's right-sided, left-sided, if it's central, if there's nerve root compression, if there's what's called thecal sac compression, which is the sac that surrounds the spinal cord.
Wow.
So we do a lot of diagnostic tests to help us determine, number one, if they're a candidate for our program, and number two, specifically what disc we have to treat, because there's 5 discs in your lower back.
You know, there is nothing worse than that lower back pain, and sometimes you think, oh, I just must have pulled a muscle, I just must have. But the older I get, the more careful I'm you know, bend at the knees and lift carefully. But it's just one of those things that you take for granted, the health of your back and your health in general.
Everybody does. And then as you go through life, as you said, you know, when you're getting a little bit older, you start to be a little more careful of your posture. But when you're younger, you just bend and do whatever you want, and you don't think about it. You know, say, oh, it hurts a little bit today, but I'll be better in a couple days. It's those little micro traumas that over the years develop the problems.
How could I make an appointment with you? Do I have to be recommended by my GP to get in to see you?
Not at all. You can just call our office directly and schedule.
You are so very involved in this community. You're even a Little League coach.
I've been coaching Little League. I took this year off because of just conflict with my office hours. But I've been coaching my younger son in Little League for 5 years now.
Here in the Northern Kentucky
In Northern
area.
Kentucky.
Yeah, how they doing?
We're having about an okay year, about 500 this year. We switched from Little League over to the Southwest Ohio League, so we're playing a little more competitive teams.
Oh, that's nice. It's nice to know you're a family guy, just a great dad doing the kind of work that you're doing. What is your typical patient? Who is the person who comes to see you, and what are their hopes when they come into your office?
For this particular program, we're really looking at the boomers, that 55 and older age. And really what most people are looking for is to get their life back, because our typical patient has already been to the orthopedist. They may have seen another chiropractor. They may have gone through physical therapy. Many people have had epidural spinal injections trying to decrease their pain, and they're trying to avoid surgery. And what we give them is their life back.
If I choose to have a spinal decompression as the mode of my treatment, what does that mean? What time constraints do I have? Do I have to take off work? Do I have to have someone take care of me?
No, nothing like that.
Nothing.
It's about an hour per treatment. You're on the specific decompression table for half an hour per session. And then we do a lot of other work in our office, because we still do chiropractic adjustments, but we don't do the traditional style adjusting. We use a computerized instrument called a Pro Adjuster that the computer performs the adjustment for us. We do a lot of physical therapy, because if you don't stabilize or strengthen the muscles off to the side of the spine after we get the pressure off the disc, it's not going to be effective.
And how long do these treatments, how long of a treatment period do I?
A typical treatment program is going to be somewhere between 24 and about 34 visits.
Wow.
So it's an involved program.
Well, it certainly is non-invasive. No one ever wants to have that type of surgery performed. It sounds like a wonderful alternative to that other way of thinking.
We've been doing this for a little over 5 years in our office, and we've helped hundreds and hundreds of patients avoid surgery. One of our most recent successes is we had an older woman, Irene. She's 86 years old, came to our office in a wheelchair. She had been to the surgeons. They were wanting to do surgery, but they didn't feel she was strong enough for surgery.
Sure.
Within a month of care, she went from a wheelchair to a walker, and now she walks a half a mile a day.
That is incredible. All incredible and very non-invasive. If you want to get in touch with Dr. Kendall Gerhardt, here's the number on your screen. And it is a wonderful opportunity for people who don't want to have to go through that invasive process.
Yes.
So good to see you again.
Very good, Nancy. Thank you for having us.
Oh, thank you. We'll be back with more on Northern Kentucky Magazine on ICN 6.